Thank you for joining us for this vodcast on how to care for your PICC line catheter. During this video, you will see a nurse caring for a patient who is going to be discharged with the PICC line. Please pay attention to the questions the patient and the family member asks, as they will help you understand how to care for your line and how to prevent infections.
Heidi, I'm Sabrina. I'm the PICC nurse. I hear that you're going to be discharged today. So the most important thing is, can I know who this is?
This is Tara, my roommate.
Okay, wonderful.
Hi.
So you're going to be helping Miss Heidi here do her central line dressing change at home, correct?
Yeah.
Okay, wonderful. So I'm going to talk about it while we go on. So before I came in, I had washed my hands, and I would do hand washing again. It's essential to prevent infections because, again, our hands carry germs. So you want to do your 15 to 30 second hand scrub with soap, and of course it wants to be antimicrobial soap. You're going to receive care packages like these, okay? And all you do, these are sterile dressing changes. So you're going to be supplied with sterile gloves.
How long is she going to have the PICC line?
She's going to have the PICC line up to completion of her chemotherapy. So if your physician ordered this for 5 to 6 cycles, you're going to have it to completion. I'm not sure exactly how long your oncologist has you scheduled for your chemotherapy. But these PICC lines can last up to a year if taken care of properly. And from then you might want to look into different types of central line catheters such as Hickman or Portacast. I recommend Portacast.
Hopefully I won't get there.
Hopefully not. Most important thing, Ms. Heidi, is that you and your roommate here, Tara, always make sure you wear your mask. And I'm being very careful when I open this to not contaminate it. So I will let you put this on yourself.
Please note that for the sake of this video, Sabrina, the nurse, is not wearing a mask. At home, anytime you are changing your dressing, please ask those around you to wear a mask to help prevent infection.
So you'll be given 2 pairs of gloves in case you were to need both. And we normally use just one. So I'll put this one to the side, and I'm going to use you as my little stand, if that's okay, Miss Heidi. And we will supply you, Tara, with any additional supplies that you need. If you need gloves that are different size, so that would fit you properly. Now these are a little too big on my hands normally. So I'm going to just put them down here for now. These are our drapes that we typically use when I and the other PICC nurses insert yours. However, we're not going to be using this because you're going to go home and that's your natural environment. You're going to be exposed to all the same pathogens and organisms that you normally would encounter. So for these, we won't be doing these here at your house. So I'm going to open up all my sterile supplies like I normally would do. These are the caps that will go at the end after we clean them. So I'm just going to put them in my sterile fill. Your sterile fill, Tara, is up to 1 inch around the margins of the packaging. So as long as you're staying within 1 inch of it, you're considered sterile. So I will review what you have so far. So these are the Chloropreps that we use to clean the site. There are 3 swabs in here and you use them all. You don't just use one. What the first one you'll do is you'll go one way. You can go north to south direction. You can go east to west direction for the second one, and I will show you when I do that. And the last one is a circular from in to out. You never go out to in because you want to clear the way of the pathogens. And you want to allow adequate timing for this to dry, to not cause any irritation under the skin. It's not too uncommon if patients don't allow enough time for this to dry that you start to develop a rash under the tegaderm tape. We only use this when we're about to insert it in, or if you believe you have developed an infection and you feel like your arm is swollen, you would use this to measure the circumference around your arm and compare it to what it was before when they put it in.
You do that every time?
No, we only do that if we look like it's going to be, if it's swelling, if it looks very red and irritated, indicating an infection, or if Miss Heidi's having pain when she moves to indicate that she could have a clot. So no, on normal basis, when there's no any indications or nothing concerning, we won't do that. Then these are the alcohol swabs that we use to clean each end of the port. And this is a tegaderm that's going to go over it. So Miss Heidi, I'm going to just ask you really quick to kind of move your gown a little bit that way, because it is, there you go. Thank you. One of your gloves, Miss Tara, is going to become unsterilized, especially if you're going to be holding the catheter site, but that's okay. As long as you keep one hand sterile, you'll be good. So you would go down, doesn't matter which way you want to go. Make sure you go a certain distance out. Then you would throw away in your trash can or your disposable area. Then you're going to go east to west or west to east around the site. And for this last one, this is the one that I was referring to earlier, where you start inner and go outer as a circle. So you want to get as close as you can as around the insertion site. Apologize, Miss Heidi, this is pretty much drenched, I know.
It's okay.
Okay, so then the next important thing is allow adequate time for it to dry. While that's drying, what you could do is use these. Would you like to open it for me? And this is where Heidi will come in and help her when she's doing the dressing change so that she doesn't contaminate anything else. So you would cleanse the ports of one. There would be little ports here already, and you would take them off and clean these prior to adding another one. Do you guys have any questions so far?
No, I think it's making sense.
Well, I just want to know, how am I supposed to take a shower with this thing?
So what you would do is you would get, like, for example, a Ziploc bag, the large freezer ones, the hold quart sizes. Because you have a narrow and thin arm, what you could do is cut a hole at the bottom across, and you can cut another one on top where the parts come together. And you would put that around your arm, and then you could wrap it in and tape it around securely. But again, you don't want to tape it to the point where it cuts off your circulation, but enough to cover the areas where it would become wet. However, if you knew you were going to change your dressing that day, you could shower with that on, and right when you finish showering, you could do a new dressing change. So, like I said, it's normally 5 to 7 days. Typically, if patients come keep them clean, you can do 7 days.
So I leave the same dressing on for 5 to 7 days?
5 to 7 days. However, if it becomes soiled in between there, maybe after you were doing something outside and you noticed that it got dirty, I would recommend, of course, that you change it right then and there.
Okay.
So your supplies are also going to depend on how many times you're going to have to change it. So I wouldn't recommend going out if you know you're going to get it dirty. Like, if you're going to do something, do change it that day, but if you can hold off, wait a few days. There's an area on here where you can put your initial, the time, and a date, so you know when it's been 7 days and the last time it's been changed, or again before that. So now it looks like it's been adequately dried. I'm going to go ahead and put these down because I just need to make sure that right here it remains sterile where the insertion site is.
So how does that thing stay in there? I mean, like, how will I know if I pulled it or something?
what's going to happen is, while I put this down, as you see, it's sutured into her.
Oh,
so
okay.
as long as you're not tugging it out, it shouldn't come out or slip out. However, I was holding it earlier with this hand, my left hand, it depends if you're righty or lefty, so that you can hold it in place to not have it slip out, because you do want to make sure that how much is coming out is how much the PICC nurses like me put it in. Because again, they can slip out easily if they're not really sutured well. And so you can hold it again at the bottom with this, because you don't no longer need to be sterile, and you just wrap the tegaderm around. Not too tight, not pulling the skin or anything, just holding it good. So you want to be able to determine the length of this still, and then make sure that the insertion site's covered good. Okay, and then what happens is that this part comes around very nicely and holds it there like that. And then you would put the little part I was telling you about with your initial time and date just right on there after. So I'm going to pretend that we already initialed it, and that's something that you could do after, because again, you don't need to be sterile at this point. And you just put it there, and you're finished. And any time that you use these, you always want to clean again with alcohol for about 25 to 30 seconds. And if you don't know how long that is, you can sing the happy birthday song to you. And then always flush it before with 10 mils of normal saline. Give your medications, and always flush with 20 mils of normal saline.
Are we going to be giving medication through this?
No.
Oh, okay.
No.
We don't have to do the flushing part.
You know what? You might want to ask your doctor, because especially if the home health nurses are not coming and you want to make sure it's still working, you can always flush it at home. Because if you're not going to your treatments every day, someone's going to still need to flush it.
Oh, every day?
Mm-hmm.
Okay.
You
Did
should
know
do.
that?
Well, I do now.
Okay.
You flush these each port twice a day with a 10 mil syringe. And what you want to do is, what you're doing is keeping the patent and open, preventing clots from forming. Anytime you feel resistance when you're trying to push, never force it, because you could dislodge a clot. Or if there's bacteria, pushing bacteria in further. So you always want to clean it. If it's not working, you'll talk to your doctor. He will most likely have the registered nurses come out and give a medication that's a blood thinner to declot the clot. Most commonly we use calf flow.
Okay.
And it normally works without any problems.
So if I have any problems without being able to flush it, I call the doctor.
Correct.
Okay.
Yes. Never try to force anything on yourself, and never try to use anything that you have at home and put it in there.
Oh, okay.
Okay. So that's all we need to know?
For right now, yes. It's just for you guys, we wanted to show you how to do the changing, and then of course when you flush it and how often with the normal saline. Other than that, you'll be taken care of when you go and see your oncologist when you're getting your chemotherapy. The most important thing is just keeping that clean and safe for infection.
So will the home health nurse show us how to do the flushing, or will you do that?
I will do that, or the home health nurse
Okay,
will.
okay.
Or your nurse will come in and show you
Okay.
shortly after I leave.
So I need to be very careful not to cause any infection in the area, and that's why we wash
Correct.
our hands?
Yes.
Okay.
Always wash your hands right before.
Okay.
How will we know if it's infected?
Normally what happens around the insertion site or up the arm, you'll have some redness, some warmth, or induration. Induration is like a firmness to it. You can feel that your arm is swelling. All of those can, or pain, that can indicate infection. Most commonly, if it's a clot, you're going to have pain, again, some redness, some swelling. So you could be, if it's either infection or a clot, you're going to want to see your primary care provider. But if you were thinking it might be a clot, I recommend you don't do a lot of any exercises with your arms and attempt that you might dislodge it. I would try to keep it just next to you without any movement until you come see the doctor. If any time you feel short of breath, you can't breathe, and you were having pain and redness there, you go to the emergency right away, because most likely the clot has dislodged and it's now in your pulmonary vasculature and cutting off your ability to circulate the oxygen.
Okay.
I don't want to scare you, Miss Heidi. It doesn't happen as often.
You sure you want to take this home with you?
I don't think we have much of a choice.
Thank you for joining us. If you have any further questions, the following website is available at www.powerpic.com.